Hey everyone, Dr. Mike here. If your kids love being outside, playing in the woods, hiking, or even just exploring the backyard, there's a good chance they'll run into poison ivy at some point. So today I want to give you a quick rundown of what poison ivy is, how it causes problems, what symptoms to look for, and how to treat and prevent the rash. So let's start with the basics. Poison ivy is a plant that typically grows in clusters of 3 leaflets. You might have heard the saying, leaves of 3, let them be. It can grow as a vine or a shrub, and it's super common in many parts of the United States. The problem with poison ivy is not the plant itself. It's an oil called urushiol, which sounds like a Mario Brothers character, but it's an oil found inside the leaves, stems, and roots of the poison ivy plant. That's right, the oil is inside the plant. However, the stems and leaves are fragile, so anything that disrupts their surface, like animals brushing up against the plant or insects chewing tiny holes in the leaves, this allows the oil to leak onto the plant surface. Then, if you come along and touch the damaged poison ivy plant, which might not look damaged, the oil sticks to your skin where it can trigger an allergic reaction, even if you've never had a reaction to poison ivy in the past. In fact, maybe you touched it once, but it wasn't a damaged plant and you didn't get the oil on. But the next time you come along, maybe it's a damaged plant and you can't really tell the difference, and the oil sticks to your skin. Now, here's the thing, the oil sticks to more than skin. It also gets on clothes, shoes, gardening tools, even pet fur. So you don't have to touch the plant to get the rash. Using last season's gardening tools and petting your dog or cat can also result in symptoms if the oil is present. So what are these symptoms? Well, the first thing to realize is that urushiol sticks to human skin permanently in less than an hour. And then within 12 to 48 hours after contact, you'll notice redness, itching, and maybe even blistering. The rash can be mild or severe, depending on how much oil is stuck on the skin and how sensitive you are to it. And just to clear up a common myth, the rash itself is not contagious, at least not after the oil is permanently bound to the skin. It may have the appearance of spreading because areas with the most oil contact tend to break out first. Now, if the oil is fresh, so within that first hour, or it's on clothes, gardening tools, or pet fur, which do not form a permanent bond, then yes, the oil and the rash can spread. If you think your child's come into contact with poison ivy, the best first step is to wash the skin right away with soap and water, preferably within 10 to 15 minutes, as this can remove the oil before that permanent bond has set in. But once the oil sticks to the skin permanently, you have to wait for your body to make new skin. Of course, we're constantly doing that anyway, making new skin, with the outer layers of skin falling off, so you have to wait for that skin with the oil stuck to it to fall off and be replaced with new skin, which is a process that usually takes 2 to 3 weeks. And that's why poison ivy rashes last for so long. So what can you do about the itching and discomfort, especially when it's moderate to severe? Well, you can use calamine lotion, antihistamine medications by mouth, such as cetirizine, also known as Zyrtec. Speaking of antihistamines, you want to avoid diphenhydramine, also known as Benadryl. It's an older antihistamine with lots of side effects. Hydrocortisone cream, which is a steroid, cool compresses, and even oatmeal baths can bring relief. If the reaction is widespread, severe, on the face or in the groin area, then it's time to check in with your doctor. Sometimes a prescription steroid, taken by mouth, is needed to calm things down. Also watch out for skin infection. Scratching the skin can cause microabrasions, which allow surface bacteria to invade. So if an area of poison ivy rash is getting swollen, firm, painful, or if drainage or fever are present, let your doctor know. In that case, an antibiotic might be needed. As for prevention, it's all about awareness. Teach your kids what poison ivy looks like. Again, leaves of 3, let them be. Pull up pictures on the internet and point out poison ivy without touching it, of course, if you see the plant while out and about. When hiking off-trail or playing in the woods, long sleeves and pants offer good protection. And when you come back inside, make it a habit to wash hands, change clothes, and even bathe your pets, especially if they've been running through the brush. No question, poison ivy is annoying. But with a little knowledge and quick action, you can avoid or minimize the rash. If you found this information helpful, be sure to like this video. That'll help spread our evidence-based content far and wide. And for more child health and wellness tips, please subscribe. These things really help the channel. If you have a comment, question, or topic idea, please drop those below. And as a reminder, PediaCast is also a podcast. In fact, we have nearly 600 episodes in the archive on just about every pediatric topic you can imagine. You can find those episodes here on our YouTube channel, over at pediacast.org, and wherever you get your podcasts. Until next time, this is Dr. Mike, wishing you and your family a wonderful day. I'll see you again soon.